count. 5, 4, 3, 2, 1.
Hello, everybody. Welcome back to our Community Cares Public Affairs series. I'm Daniela Levine-Cava, County Commissioner, District 8, and we have been bringing you information about how we are coping with COVID-19 in Miami-Dade County. We have had over 3 weeks of programming with some wonderful speakers. You've heard about jobs, you've heard about healthcare industry workers, you've heard about hotel and hospitality airport workers. Also, we've talked about tenants' rights and unemployment benefits. We've talked about mental health issues and domestic violence. It's been really the gamut of issues that we are all coping with and concerned about in this brave new world. So if you have not had a chance to tune in before, all of those shows are archived on Facebook Live. Please take a look. And we have some exciting programs coming up, and we'll tell you about that at the end of the show. But today, we have a very special guest, someone who is in the news. This is Dr. Erin Kobetz. She's my personal friend and someone who is a leader in community health. So we are delighted that Dr. Kobetz, who's been leading the groundbreaking epidemiological public health study to look at the incidence of the COVID-19 virus or exposure to coronavirus in our community. And she's going to tell you all about this study, which has gotten off to just a really great start. It's part of the national movement that Dr. Fauci has recommended communities undertake. So we're so proud once again to be at the forefront. And we know that everybody is just struggling to get by and coping with this brave new world, and learning about this study and how it is going to help us prepare as a community is another great feature. So welcome, Dr. Kobetz. So glad you could be with us. And of course, I have to reveal that we've known each other for a few decades, and it's been my privilege to work with you on some other groundbreaking projects. So we know you are the right person to lead this effort. If you could tell us a little bit, please, about how you got into this work, and what it is that you and your colleagues at University of Miami are undertaking.
Thanks, Daniela. We have known each other for a lifetime. You were definitely my first community partner many years ago when I moved back to Miami, recruited by the School of Medicine to start a program in health disparities, and I'll never forget that, so thank you.
Thank you.
So you know that my work to date has really been on attenuating disparities in cancer outcomes. And I've been privileged to do that work with diverse communities, including firefighters and women and men in the Haitian diaspora. And about 2.5, 3 weeks ago, just as the COVID-19 crisis was coming to the forefront of our national dialogue, I got a phone call out of the blue by a man named Kevin Linsky, who works at Miami-Dade Water and Sewer. And he said, I need your help. The mayor would like to do a community surveillance effort. And I hear you're an epidemiologist, and could you share some skills about how we would do this with the kind of rigor and integrity required for us to generate some real data to inform true operational decision-making and our public health response? And I thought, wow, this could be really great, because I think one of the things that we're collectively experiencing with COVID is a feeling of like shared helplessness. And so I thought that if I had the ability to use my professional skills and mobilize my teams of researchers and students to work collaboratively with the county to understand what was happening in terms of COVID locally, then it would be the right thing to do.
Wow. So you heeded the call. It came out of the blue. This was not what you were planning to do for the next month or so, right? Very, very impressive.
No.
And
no, but I think,
go ahead.
Go ahead. I was just going to say, like, I think it's, you know, the University of Miami is the only academic-based healthcare system within South Florida. And so it makes sense that county leadership would look to us to lend a hand in applying our epidemiologic and research skill set to an issue of real world significance.
Yes, and we spoke last Friday, as it happens, with President Julio Frank and with the Chief Operation Officer at UHealth, and we heard about the range of important research work that is going on at the University of Miami. And obviously they spoke about your work, and it's an important piece, but it's not the only piece of COVID-related research, right?
Not
So
at all.
so could
Not
you
at
maybe
all.
tell
So
us some of the others?
yeah, so, you know, one of the things that's been interesting for me over the past year is that I've been transitioning into the role of vice provost for research, which means that all of the scholarship that occurs across the university will ultimately report up to me, and that I'll use like our shared knowledge to create a strategy by which the university uses its scholarship to help impact community well-being, among other important outcomes. And so John Bixby, who's the current vice provost, and I put together a rapid response for applications across the entire university that were in line with an innovative approach to helping understand or address the COVID pandemic. And we put out the call for about a week. And after a week, we got upwards of 40 applications
Oh
from
my goodness.
people all over the university. And some of the
Yeah.
projects for me were really unexpected because I'm a biomedical researcher. And so I'm thinking about clinical trials pairing chloroquine with azithromycin or plasma donors. And we got amazing work on art demonstration projects and efforts to understand the impact of physical distancing on children's educational attainment, and work using economic models to predict like what will happen in South Florida and beyond, given that the economy is different than we've ever known it. And so we funded 24 of those projects. They're totally interdisciplinary. And I think it really speaks to the innovation across the university and a collective willingness for us to use our research skill set to advance a common goal.
Well, that is very impressive. I know I've had something to do with research, university-based research, and it's often a very time-consuming process to get clearance through the investigative review committees and so on. So you were able to create a protocol that allows the university to be very agile and move forward. And I know there's some different kinds of, there's a pulmonologist that's doing something very dramatic on treatment, and some other things that are going to hopefully cure. Excellent. Well, I'm sure that people are very interested to know the details of the research that you've undertaken. I'd love to get into more of your background, but let's start with the research project at hand. If you could describe it to us, what exactly are you doing for community health surveillance, and why is it so important?
Okay. So let me start with the second part of the question first. So community surveillance is critically important because we are somewhat moving in the dark in terms of understanding the local burden of COVID-19 infection. So with limited availability of widespread testing and it currently being restricted to individuals who are sick, who have a known exposure, who are older than 65, or who are immunocompromised, we are missing the broad swath of individuals who may have been exposed, are infected, and are asymptomatic. And without that information at hand, we have no way to effectively structure a public health response that can ensure that our broadest part of our community, including the most vulnerable, are protected and served. So that's why we do community surveillance. So what we are doing is taking a random sample of residents across Miami-Dade County. And the reason why we want this sample to be random as opposed to comprised of willing participants is we really want to get the best snapshot or picture of what's happening locally. Sometimes if you allow people to volunteer for a research initiative, you get an overabundance of individuals who have symptoms, and that forces you to overestimate the true burden. And so we really want a random group of individuals from across the county. That random group is really large. So our next testing day is tomorrow. We've recruited over 900 individuals from every part of Miami-Dade County. And the sample is completely representative of our diverse racial ethnic composition. And I think that's really important because as we look to New York and Boston, there's a lot of conversation about people of color being overrepresented both in the incidence data for COVID and certainly the mortality. And given that South Florida is potentially even more multicultural than those two metropolitan areas, we really need to understand who is the most vulnerable for COVID locally, and then collectively to come up with some real-time strategies to address that vulnerability.
So that's great. So this is why it's so important. And I just want to remind our listeners that we are going to take your questions and comments. So please post them on the Facebook Live, and we will get to them shortly. If you could go ahead, Erin, and tell us exactly process-wise, how
So I
are
can
people
tell you
recruited to
that.
the study? Yes.
Okay, so the process is as follows. I worked with Kevin Linsky from Miami-Dade Water and Sewer to divide the county up into what we call minor statistical areas, which are basically the neighborhoods that we know and consider to be our homes. And then we worked with Florida Power and Light, who is randomly calling residences within those minor statistical areas. The large majority of people who get calls don't pick up. They go to voicemail. But if someone were to pick up, they hear an automated message from the mayor that gives them a brief overview in English and Spanish about what it is that we're doing. And then if individuals want more information, they press 1, where they're patched through to a phone bank that's being virtually staffed by about 150 of our medical and medical public health students. Those students then provide a further overview about the work. They do so in English, Spanish, and Creole. They get verbal consent for individuals who are willing to participate. They administer a brief survey that's been validated by the Centers for Disease Control that asks questions about coronavirus risk, possible exposure, symptoms, other comorbidities. And then individuals are scheduled for a testing day, usually about a week out, maybe a couple days less, at a community site within their local neighborhood. And for the most part, these community sites have been libraries. Individuals are scheduled in 10-minute increments. They show up and there's a tent where they can drive up. They sign another consent. They stick their finger out the window. We take a drop of blood. A firefighter does that. And we process the test on site. People leave, and then we call them within an hour with their results. And all of the results that we get together are aggregated in a way that allows us to estimate the prevalence of infection. Now, I should say that we're using a serologic antibody test. So what the antibody test actually tells us is whether your immune system has made antibodies to the COVID infection, which basically speaks to your exposure as opposed to necessarily active infection. The only way to get an active infection is through a nasal swab that uses technology called PCR to detect viral DNA, or viral RNA, excuse me. But what's so important about the antibodies is that it allows us to understand the broad range of people who've been exposed and how that's changing over time and by geography.
Okay. And I know there's a lot of confusion in the public about these different kinds of tests. And so tell us, what can this test not tell us, for example? Why is this not the ultimate test for people who...
This test doesn't tell you whether or not you're infected with COVID. What this test tells you is whether your immune system has made antibodies to the COVID infection, which would imply that you've been exposed to it. Now, what this test does is it looks for 2 different types of antibodies. The first is IgM, which is what a person's body makes shortly after they're exposed to an infection. And what we know from the first SARS epidemic is that people tend to make these antibodies within 3 to 6 days after their initial exposure to coronavirus. The test will also tell us if you have IgM plus IgG, which would mean that you are probably in the mid-course of an infection cycle, even without symptoms, because your body has started to generate a new type of antibodies that starts to speak more like long-term immunity. And then the test can also tell you if you have IgG. So it tells us about 3 different sort of phases in the infection curve with regard to antibody development.
So I know you're referring some of the people for the swab test. So can you explain, after you do this initial blood prick test, who would get referred for the bigger test, the longer test?
So we're not really referring anybody in this study unless a participant mentions that they're having really severe symptoms. So if a participant is having severe symptoms and they test positive for antibodies, at that point, we will try to navigate them to one of the local testing sites that's primarily staffed by the Florida Department of Health in collaboration sometimes with the National Guard or the University of Miami or Jackson Memorial Hospital.
Okay, so I think then, would it be correct to say if you think you maybe have been exposed or you might be sick, that you need to call 311 or the other lines to go to one of the test sites, get an appointment. That this, what you're doing for research is for the public's good, not necessarily for your own individual screening for the disease.
Exactly. So what we're doing is public health, and public health practice speaks to the need to do the greatest good for the greatest number of individuals. And so what we're doing through this surveillance effort is trying to determine how to accomplish that end, and not necessarily providing recommendations to individuals on the basis of the symptoms or the results of this test. Now, clearly, we're sharing the results of the test with everybody who participates, because arguably, if you're IgM positive, you may either want to try to get a PCR test, or if you're feeling okay, you may choose just to self-quarantine for about 14 days to prevent spreading it to other people within your family or social network. But the goal of this is not to improve individual health. The goal of what we're doing is to improve the community's health.
Okay, very good. So we have a question from one of our listeners, and she says, my husband has been called to participate. When will he receive an appointment to appear?
Okay, so we actually have been working in two ways. So FPL was calling tons of people through their random list, and we are finding that upwards of 50 to 75% of those calls were going to answering machine. So now we've started a different approach where we are making some direct calls to individuals themselves, and somebody like the participant's husband will likely get a call in the next day or two, depending on where she lives, to get scheduled for next Tuesday.
Okay, very good. And we had another person as well who had gotten a call from a live person asking if he was interested, and he said yes, but he hasn't gotten that call. So he should expect
it'll be
the call
in the next day or two. So we had our big push to get 900 people signed up for testing tomorrow. And now we are in the process, probably starting right now around 4 o'clock, to start calling individuals back to get them scheduled for next week. So thank you. There's a 1 in 10,000 chance of getting picked. So it's kind of like the golden ticket. I am fielding so many people. I'm fielding so many emails from individuals across the county who really want to participate, either because they think they've been exposed or they just think the work in itself is cool. And I have to keep telling them, no, it's a random selection. I appreciate your willingness to participate, but you have to be randomly selected. And they write back, what's the chance? I say 1 in 10,000. So these two people are really lucky.
Yes. Well, and we're so fortunate that they have agreed. So thank you so very much for taking that call, for agreeing.
And it's all voluntary, obviously. So
Yes.
People choose to participate or not at their own volition. And one of the things that we're really hoping to do is to identify hotspots throughout the community where there may be a higher than expected prevalence of infection, and then to really provide targeted testing and other resources to those parts of the community to reduce the burden in a proactive way.
Excellent.
Proactive community-based way, I should say, Diane.
Yeah.
Daniela.
Well, I was going to ask you to tell us a little bit about your orientation as a community-based participatory researcher, because the kind of research that you've always done is somewhat unique. And how does that fit? Tell us a little bit about that, and how does that fit with this particular study?
I can always count on you to ask me the very hard questions at 4 o'clock in the afternoon. So I am a community-based participatory researcher, which means that I generally work hand in hand with community stakeholders to conceptualize the research that we will collectively pursue. And the reason I believe this work is so important is that I recognize that I have a certain expertise as a scientist, but that's limited by my lived experience. And if I want to work with the community to affect health and social change, I need that community to be a meaningful partner in conceptualizing what questions to ask and how to best ask them. And Daniela knows this very well because we actually work together on a community-based participatory research initiative that spanned over 15 years, Daniela. That's how old that is. This project is a little bit different in that you have a lot of stakeholders at the table, including some community members, but the idea didn't necessarily come from the community. It came from the county as a way to structure a potential public health response that could be progressive in meeting the needs of the broadest community. But I will tell you this, that as we start to generate results, I will rely on my community colleagues to help think about how to interpret those results and certainly how to communicate them, depending on the communities that we find, which may be overrepresented in the viral statistics, and helping them have us think through what solutions may be community competent and culturally sensitive, and what the needs are so that we can respond in a way that feels supportive, which I think is ultimately our goal.
Thank you for all of that. And so, for example, we have understood that the disease is affecting communities of color, African American communities specifically, more so. And if you find that borne out in the data, you're saying that you would work with communities to help them understand the impact of this disease, and how as a community they can better cope with, prevent all the implications.
You know, maybe also bringing resources. So like, we had a brainstorm session about this today with some of my community collaborators, and we were thinking a little bit about a New York Times editorial which spoke to the fact that there are fewer primary care physicians for many medically underserved communities that tend to be disproportionately represented in COVID cases in New York and Boston, and thinking about how we could create a core of those individuals who could maybe do telehealth in those communities to help assess symptoms and to make sure that other comorbidities such as diabetes are adequately managed. We thought about doing targeted testing that would be free and voluntary and widely available, thinking about bringing together community organizations who sometimes work disparately but for the same purpose to help fill gaps in food and other immediate needs. And so there's no way for me to know exactly how to do that, but I'm certain if I bring community stakeholders to the table that we will generate solutions that will be meaningful, measurable, and impactful.
Well, I thank you for that. And I just want to underscore this for our listeners. You know, sometimes people are wary of participating in research because they think, just they're going to be a number and it's not for their benefit. But I think you can see Kobetz in doing this work is not only doing it for the benefit of all of us as a community, as a society, but trying to find ways to make it beneficial to the people who participated in the study. So I really want to commend you for that. And the whole approach of community-based participatory research is about the community owning the data. It's data that isn't for the sake of some Nobel Prize application, although perhaps there might be one in the future. It's really for the benefit of the community, and I thank you for that. Now, I've had a comment here from Fermin Eduarte. I don't know if that's your colleague. He says, we've tested less than 1% of Florida's total population, and in Miami-Dade, only 1.5% of the county population. The number of cases is running at 18% of cases tested are confirmed positive for COVID-19. How can we make any decisions based off a relatively smaller sample size than what would be required to represent the entire population? Question.
So I think that's a really good question. So the county has about 2.8 million people living in it, and a random sample of around 800 individuals, which is what we're planning to do once a week for the next 4 weeks, is actually a representative size by which we can generate prevalence and inform decision making. And I think this is a really important point, because when you think about how testing's been done thus far, you're really only focusing on the tail end of the distribution. You're only focusing on those individuals who we know are sick and we know are high risk, either because of age or being immunocompromised, or initially because we knew they had certain exposures. And we were trying to focus in on that group so that we could potentially reduce excess mortality or deaths from the virus. But what we're trying to do now with the surveillance is understand the distribution across the population at large, and then think about public health measures that could shift that distribution out back by reducing transmission and facilitating access to care for everybody broadly. And so it's a little bit different. We can't make good estimates based on the test results that have been reported, because that's such a limited subset of the broader population, which is why we're doing community surveillance, which is to get at the question that this very smart viewer asked.
And someone else is asking, how long will this study go on? Somebody was called and missed the call and is regretful now. I don't know
Don't
whether.
be. So
Yeah.
the study is, we're going to do it for 2 to 3 weeks. So, and then we're going to see where we are. I think one of the things that's really interesting about the antibody testing is we can start to see trends in how antibodies may be shifting by place and time. And so our goal has been 4 weeks, but we really need to see how we're doing. Last week we did a feasibility run, and we did screening of 400 individuals in 7 of the community sites in which we'll be operating. And I have to tell you, I was really impressed because 85% of the people who were scheduled to be tested showed up. And from epidemiology, community surveillance, that's a very, very high proportion. We're able to get back in touch with everybody to share results. We're able to navigate those good questions to additional resources. And we didn't have any equivocal findings. The tests were working. We were able to read them appropriately. And so I think that's very encouraging. It was a feasibility run. One thing that we can glean from that data, even though it's not robust enough for me to say anything with true statistical confidence, is that I think certainly the burden of infection is higher than what we know based on the number of positive test results reported by the DOH. And probably half of the individuals who are positive are asymptomatic and report no symptoms in the 7 to 14 days prior to being screened as part of this study. And that's critically important because asymptomatic individuals are the ones who run the risk of potentially transmitting the virus to others in their social network unknowingly.
And this is why now everybody is being recommended to wear masks when they're out and about, because it's not just about somebody else transmitting to you, it's about you protecting other people through your
and sunglasses too, if you can.
And sunglasses
actually,
for your eyes. Very good.
You'll appreciate this. The community support for this effort has been somewhat overwhelming, and beyond the numbers of emails from individuals who want to participate, I also was connected with a group, JA Uniform, who's a local company and has been a local company here for decades. And they made a series of cloth masks, I think upwards of 300 of them. And so at some of the community sites tomorrow, we will be distributing those masks to participants because we know how hard it is for people to get their hands on them. And so we're so grateful to the people such as JA Uniforms who's come forth as a key partner in this effort, because it's a way that they help us give back for participation.
Excellent, excellent. Well, that's actually a great note to sort of wrap up on, because this series is called Our Community Cares. And your example is just one of the great ways people are stepping up each and every day to do something for their neighbors, for strangers, because we are all in this together, and together we will get through it. So I just want to thank you so very, very much for undertaking this study, for your leadership. This is unique in the country, as I understand it. We're the first community to take this on as a community-wide effort. So you not only took Kevin Linsky's call, our Water and Sewer Department Director, who seems to be our guru on these things, but also Dr. Fauci, who's our Chief of Infectious Diseases for the country, who has called upon communities to do this work. So it's a pleasure to have you. Thank you so very, very much. Did you have any closing remarks before I plug our next show?
No, I just wanted to say thank you for the opportunity, Daniela, and thank you to the listeners. And I've been very inspired by Miami-Dade County and the broad outcry of support and willingness for community members to stand up and take the opportunity to do something small that will make a very big difference. So thank you.
Thank you so very, very much. Oh dear, there is a question, and I do want to be sure to, okay, we have a couple more questions. So after closing out, we're back to you. So is anybody else doing antibody testing not through the study? If they could go.
So I think the answer to that is yes. Like, for example, I read an article in the Miami Herald yesterday that Banyan Health has set up some testing sites in the Aventura Mall the antibody testing that they're providing is for a cost, either through insurance or through self-pay. I think these tests are becoming more and more widely available. And I think hopefully our study will inform the appropriate use of these tests for clinical decision making, because right now we really don't know. What the CDC is really endorsing is the use of a PCR nasal swab, and the serologic test is maybe another way not only to understand what's happening locally, but to give us a broad sense of immunity, and also maybe a way to decide who can return to work.
Okay. And then somebody else who is a driver, Uber Lyft, and has been very concerned about the transmission as a driver between the passengers and the drivers. What would you recommend for somebody who is a driver to be sure that he or she isn't transmitting the disease or hasn't contracted the disease?
So I would tell the driver, that's a really good question. So I would tell the driver that he or she should always wear a mask, and potentially, gloves, certainly if they're opening the door for their passenger or taking luggage in it or bags in and out of the car for the passenger. I would definitely ask passengers prior to picking them up, whether or not they've been sick, whether or not they have a fever, a cough, or any of the common symptoms of corona. And I would potentially refuse to give rides to individuals who are exhibiting those symptoms, because the car is such a small space that there's no way that you can accomplish the physical distancing that's recommended by the Centers for Disease Control. And perhaps maybe driving with the air off and the windows down. And if possible, making sure that when people come into the car that they also have a mask, because we know that the aerosolization of the virus lasts in the air for a while. And so you just want to make sure that both the people that are getting the ride are safe, and that the driver, him or herself, is also safe.
It underscores that these essential services, transportation, food, pharmacy, gas stations, all of the like, that we know that the people who do those jobs perform those essential functions, and our healthcare workers, of course, and our police and fire, that they are really putting themselves out there, and we need to be sure that they have what they need to take the proper precautions, and that we support them to be safe while they're administering those essential roles in our society. So thank you for the answer. Thank you for the question. And this is really, really the last question. We want to know about reinfection. What do we know about whether people can be reinfected after they've recovered?
So I don't think we know, right? So there's data right now coming from China and South Korea that people who are infected are, again, displaying signs of infection after their initial bout of illness. And so we don't know if that's like a reemergence of the initial virus or that they've been reinfected. We don't know. I mean, I think that's what's so challenging about the pandemic, is that there's such little information. And so we're trying to make meaningful decisions in real time. And that's sometimes hard, because all of us want as much information as possible to navigate uncertainty. And that is one of the reasons that we are undertaking this community surveillance effort, is because the knowledge that we gain will be critically important for helping, to the best of our ability, navigate some of that uncertainty, at least how it's playing out within Miami-Dade County. And
Yes.
so, I hope we'll have more answers soon. And I encourage everyone to stay healthy, and to thank you for your support and this opportunity.
Excellent, excellent. And while we are all hoping that there will emerge a group of people who have become immune to this disease, at the current time where you don't have any projection based on what you've just said about that, we're still learning. Is that a fair statement?
That's a very fair statement. I think I keep saying, like, we're building the plane as we're learning to fly as we're building the plane. And there's a lot of truth to that. It's a very unprecedented situation where we know so little but have to respond so quickly. And so everything that we know, will make us better prepared as we navigate a similar situation in the future.
Great. All right. Well, you've been a fantastic guest. We're so proud of the work that you're doing and of your leadership. Thank you so very, very much. And if any questions come in after, we'll be sure to direct them to you. And now, looking ahead, Wednesday we will have another episode of our community affairs, and we will have representatives from the United Way of Miami-Dade County to talk to us about their programs to provide help to those most in need. They are working through a network of nonprofit partners, and they're assisting with direct cash contributions to low-income families to make sure that they can safely provide for themselves and their families. You know, coupled with, just a reminder, Miami-Dade County is not evicting people from their homes during this emergency period. Water and sewer is not turning off people's water, and FPL has said that they will not turn off electricity during this emergency period, and we are hoping that the time for that will be extended and that there'll be no late fees charged as well. So we're working together as a community to not only understand the scope of this virus, but to help everybody in the economic downturn. So thank you everybody for listening. We'll see you on Wednesday. Be safe, be strong, be kind. Bye-bye.